The world of medicine can often feel like a foreign land, filled with complex terms and intricate procedures. For many, stepping into this world can be overwhelming, as it is filled with jargon and technical language that can be difficult to understand. However, this complexity is not without purpose. Each term, each procedure, has been meticulously developed to ensure precision and clarity in the diagnosis and treatment of diseases. The language of medicine is a tool that, when understood, can unlock a wealth of knowledge about our bodies and how to care for them. But hidden within this complex landscape are clues that can empower us to better understand our health. These clues are not always immediately obvious, but with a little effort, we can uncover them. By learning to decipher the language of medicine, we can gain a deeper understanding of our health and the treatments available to us. This knowledge can empower us to make more informed decisions about our care and to advocate for ourselves in medical settings. One such clue lies in the language of medicine itself. The words used in medicine are not arbitrary. They are carefully chosen to convey specific meanings. By understanding the origins and meanings of these words, we can gain insights into the nature of diseases and their treatments. This understanding can help us to better communicate with our healthcare providers and to take a more active role in our own care. Etymology, the study of word origins, provides a fascinating window into the world of pharmacology, the science of drugs. By tracing the roots of medical terms, we can uncover the history and development of medical knowledge. For example, the word pharmacology itself comes from the Greek word pharmakon, which means drug or medicine. This connection to ancient languages highlights the long history of medical science and the ways in which it has evolved over time. Every word has a history, a story to tell about its evolution and meaning. In medicine, these stories can reveal important information about the development of medical knowledge and practices. For example, the word antibiotic comes from the Greek words anti, meaning against, and bios, meaning life. This etymology reflects the function of antibiotics, which are used to fight against harmful bacteria and other microorganisms. By understanding the origins of medical terms, we can gain a deeper appreciation for the science behind them. This is especially true in medicine, where terminology often reflects the function, origin, or intended use of a drug. For example, the term analgesic comes from the Greek words an, meaning without, and algesis, meaning pain. This term is used to describe drugs that relieve pain, such as aspirin and ibuprofen. By understanding the etymology of medical terms, we can gain valuable insights into the medications we take and how they work. By understanding the etymology of medical terms, we can gain valuable insights into the medications we take. This knowledge can help us to better understand the potential benefits and risks of different treatments. For example, the term antidepressant comes from the Latin words anti, meaning against, and depressio, meaning depression. This term is used to describe drugs that are used to treat depression and other mood disorders. By understanding the origins of this term, we can gain a better understanding of how these drugs work and what they are intended to do. This exploration of word origins is not just an academic exercise, it has practical implications for patients. By understanding the language of medicine, we can become more informed advocates for our own health. This knowledge can help us to ask better questions, to understand the answers we receive, and to make more informed decisions about our care. For example, if we understand the term antihistamine, which comes from the Greek words anti, meaning against, and histos, meaning tissue, we can better understand how these drugs work to relieve allergy symptoms. By understanding the language of medicine, we can become more informed advocates for our own health. This knowledge can empower us to take a more active role in our care and to communicate more effectively with our healthcare providers. For example, if we understand the term anticoagulant, which comes from the Latin words anti, meaning against, and coagulare, meaning to clot, we can better understand how these drugs work to prevent blood clots. This understanding can help us to make more informed decisions about our care and to advocate for ourselves in medical settings. In addition to helping us understand our own health, understanding the language of medicine can also help us to support our loved ones. By learning the meanings of medical terms, we can better understand the diagnoses and treatments that our family members and friends are receiving. This knowledge can help us to provide more informed support and to advocate for our loved ones in medical settings. For example, if we understand the term oncology, which comes from the Greek word onkos, meaning mass or tumor, we can better understand the field of medicine that deals with the diagnosis and treatment of cancer. Understanding the language of medicine is also important for those who are studying to become healthcare providers. Medical students and professionals must learn a vast array of terms and concepts in order to effectively diagnose and treat patients. By understanding the etymology of medical terms, they can gain a deeper understanding of the concepts they are learning and how they relate to one another. This knowledge can help them to become more effective and compassionate healthcare providers. There are many resources available to help us understand the language of medicine. Medical dictionaries and glossaries can provide definitions and explanations of medical terms. Online resources and apps can also be helpful, providing easy access to information about medical terminology. By taking the time to learn about the language of medicine, we can become more informed and empowered patients. In conclusion, the language of medicine is a powerful tool that can help us to better understand our health and the treatments available to us. By learning about the origins and meanings of medical terms, we can gain valuable insights into the nature of diseases and their treatments. This knowledge can empower us to take a more active role in our care, to communicate more effectively with our healthcare providers, and to advocate for ourselves and our loved ones in medical settings. So, the next time you encounter a complex medical term, take a moment to explore its origins and meanings. You may be surprised at what you discover. Empower yourself with knowledge. Understand the language of medicine. By doing so, you can take control of your health and become a more informed and empowered patient. The end. Imagine a world where medications had no names, only complex chemical formulas. Picture yourself trying to remember a series of intricate chemical structures for each medication you need. It would be like trying to memorize a foreign language without any context or familiar words to guide you. It would be nearly impossible to remember or discuss different treatments effectively. Conversations with healthcare providers would become a labyrinth of confusion, making it difficult to ensure that the right medication is being used for the right condition. Imagine the chaos in a hospital setting where quick and accurate communication is crucial. Fortunately, we have a system of naming drugs that, while sometimes seemingly complex, often holds valuable clues to their purpose and function. This system, known as drug nomenclature, is designed to provide a standardized way to identify medications. It helps healthcare professionals and patients alike to understand what a drug does, how it works, and what it is used for. Drug names are not arbitrary. They are carefully chosen to convey important information. Each name is crafted to include hints about the drug's chemical structure, its therapeutic use, and sometimes even its side effects. For example, the suffix "pril" in medications like lisinopril indicates that the drug is an ACE inhibitor, a type of medication used to treat high blood pressure. This is where etymology comes into play. Etymology, the study of the origin of words and how their meanings have evolved, is a powerful tool in understanding drug names. By breaking down the components of a drug's name, we can uncover the story behind it and gain insights into its function. By understanding the roots of medical terms, we can begin to decipher the hidden meanings behind drug names. For instance, the prefix "anti" means against, and biotic comes from the Greek word bios, meaning life. Therefore, an antibiotic is a substance that works against life, specifically targeting harmful bacteria. This process of deciphering drug names can be incredibly empowering for patients. It transforms the experience of taking medication from a passive act to an active engagement with one's health. When patients understand what their medications are and how they work, they are more likely to adhere to their treatment plans and communicate effectively with their healthcare providers. It allows us to move beyond blindly accepting prescriptions and to engage with our health in a more informed and proactive way. By taking the time to learn about the medications we are prescribed, we can ask better questions, make more informed decisions, and ultimately take greater control over our health outcomes. This knowledge can also help us to recognize potential side effects and interactions with other medications, leading to safer and more effective treatment. Engaging with drug names also fosters a more collaborative relationship between patients and healthcare providers. When patients are knowledgeable about their medications, they can have more meaningful discussions with their doctors and pharmacists. This collaboration can lead to better treatment plans that are tailored to the individual needs of the patient. The history of drug naming is a fascinating journey that reflects the evolution of medicine itself. From the early days of using natural substances with simple names to the modern era of synthetic drugs with complex nomenclature, the way we name medications has changed dramatically. Understanding this history can give us a deeper appreciation for the science and art of pharmacology. Looking to the future, the field of drug naming continues to evolve. With advancements in biotechnology and personalized medicine, new strategies for naming drugs are being developed. These innovations aim to make drug names even more informative and easier to understand, further bridging the gap between complex science and everyday healthcare. In today's digital age, there are also numerous tools available to help patients understand their medications. Apps and online resources can provide detailed information about drug names, their uses, and potential side effects. These tools empower patients to take an active role in managing their health and staying informed about their treatments. Community health initiatives and educational workshops can also play a crucial role in demystifying drug names. By providing accessible information and fostering open discussions, these programs help to build a more health-literate society. When people are equipped with the knowledge to understand their medications, they are better prepared to make informed health decisions. Sharing this knowledge with family and friends can create a ripple effect, spreading awareness and understanding throughout the community. When we take the time to learn about drug names and their meanings, we not only improve our own health, but also contribute to the well-being of those around us. Ultimately, deciphering drug identities is about empowerment. It's about taking control of our health and becoming active participants in our healthcare journeys. By understanding the language of medications, we can navigate the complexities of modern medicine with confidence and clarity. So the next time you pick up a prescription, take a moment to look at the name. Break it down, understand its roots, and see what it tells you about the medication. In doing so, you are not just taking a pill, you are taking a step towards a more informed and empowered approach to your health.